Good morning, this is Dr. McDaniel. It's Tuesday, May 21st, and I'm speaking on hormonal intrauterine devices, or hormonal IUD. Yesterday, if you look at that broadcast, I spoke about the copper IUD, which in America is only good for 10 years, which is of course a long time, so it's good for 10 years. And it's only produced by one company, which is the Paragard company. Around the world, one can get a copper IUD for 3 years, 5 years, or 7 years, 7 years or 10 years. So lots of different years, and obviously by different companies, including Paragard, but a lot of different companies. Here in the States, it's just the 10-year Paragard copper IUD. And I spoke about the pros and the cons of the copper IUD yesterday. Now, we only have one type of hormonal IUD, and that's a progesterone hormonal IUD. Here in the States, we have a 3-year, a 4-year, and a 5-year hormonal IUD. The brands for those are the Mirena, which is 5 years, the Liletta, which is 4 years. They were originally 3 years, but they got extended by the FDA for 4 years just late last year. And the Skyla, which is 3 years. Now the Mirena company pretty much has the bulk of the production. So the Mirena company has the 5-year Mirena, the 3-year Skyla. They also have the very, very, very slightly smaller Kylena, which is also 5 years. And then the Liletta, which used to be 3 years, is 4 years. So the hormonal IUD, you can take it out whenever you want, but the longest you can keep it is that length. As I mentioned yesterday, for the copper, the same rules apply for the hormonal. We like to place them with the menstrual cycle because, one, we know someone's not pregnant if they're on their cycle when we place the IUD. There have been lots of instances of people placing it on demand, regardless of the cycle. And then, of course, the pregnancy test was negative at the time, and then it turns out that they were pregnant, but it was just too early for the test to pick it up. Good morning, thank you for watching. And the second reason why we like to place the IUDs with the menstrual cycle is because the cervix is very, very tightly closed, super tightly closed throughout the month, except when someone's ovulating and when they're menstruating. So all of the issues one reads about on the internet about how horribly painful the IUD placement is, it's because we have to dilate the cervix in order to place the IUD. And in order to dilate the cervix, that's also going to stimulate the cervical nerve, so it's quite painful. And I mentioned yesterday that I always place a cervical block, which is an anesthetic to numb up those cervical nerves. When I place the IUD, that makes a huge difference. It cuts down probably about 85% of the pain and cramping with the IUD placement. Additionally, I ask everyone to take pain medicine, and placing the IUD with the cycle, giving the anesthetic and the pain medicine, it cuts out pretty much like 95% of the cramping. Most women say it's a little uncomfortable, felt like menstrual cramps, or they had a lot of pressure, but it's not anywhere near all of the reports that you see on the internet and that people tell me who've had their IUD placed elsewhere. Now, the reasons I gave the main reasons I gave yesterday for why people who remove the copper IUD remove it early are the reasons why the hormonal IUD was invented. So those big reasons are that copper is a stimulating element, so everyone who gets the copper IUD will have heavier, longer, and crampier cycles. It will usually add 2 days in length to the cycle. The second, third, and fourth day will be at least 50% heavier, and everyone will have more cramping with their cycle. Those are the 3 reasons that the hormonal or the progesterone IUD was invented, to counteract those issues. So progesterone is the hormone that causes a menstrual cycle. We have 2 hormones, estrogen, which builds up the cycle, and progesterone, which cleans it out. Because progesterone is constantly acting to prevent blood from building up or to clean it out as soon as it builds up, it decreases the amount of flow one has with the cycle, and it decreases the number of days. So the hormonal IUD was invented to ideally cut the cycles in half. So half the number of days of bleeding, half the amount of flow. Most women have, the average cycle is 4 to 5 days, so most women on the hormonal IUD will have 1 to 3 day cycles, and they'll be much, much lighter, about 50%, sometimes more, than what their natural cycles are. The amount of cramping variables. It's supposed to logically decrease the amount of cramping because you have less flow and shorter days, but because regardless of which IUD, whether it's the copper or the hormonal IUD, everyone still ovulates. And menstrual pain, as I mentioned in a previous presentation, menstrual pain is due to the cascade of hormones or prostaglandins that are produced due to ovulation. Because everyone still ovulates on the IUD, even the hormonal IUD, the amount of cramping varies. It's not always less than the natural cycles. For most women it's less, but for most women it's less, but for a good proportion of women it's the same, and sometimes a little bit more, because they not only have their ovulation cramping, but some women will have random cramping because they'll have random bleeding or spotting with their hormonal IUD. Good morning, thank you for joining. So the catch is that not everyone who has the hormonal IUD will have less pain or cramping. And I've seen physicians or nurse practitioners, whomever, place the hormonal IUD for women who have horrible menstrual pain in an effort to lighten, shorten the cycles, lighten the cramps. Then they come into me, they're still having almost the same amount of cramps with their cycle, but then it's worse because they're not just having the cramps with their cycle, they're having it randomly throughout the month because they're randomly bleeding. The progesterone is cleaning out the uterus. Whenever the body tries to build the blood up, the uterus is cleaned out with the progesterone. So now they're not just having 4 to 5 days of cramping every month, they're having 3 days of less cramping, but then randomly throughout the week they're still having cramping, so it kind of defeats the purpose. So for that reason, I never tell anyone or recommend anyone who's having lots of menstrual pain to place the hormonal IUD, nor obviously the copper IUD for the menstrual pain. The best option for lots of menstrual pain is always going to be the low-dose birth control pill. That's going to stop ovulation, so you stop the cascade of hormonal flow, and then it will lighten, shorten cycles, and overall they're going to have much better experience with that. The hormonal IUD will lighten, shorten cycles for the bulk of women. Now that's always a bell-shaped curve, so most women are going to follow the rules under the bell-shaped curve, but you always have the extended end. So at one end you're going to have women who say, oh, you said the cycles would be lighter and shorter, and the cycles are exactly the same as they were when I wasn't on anything. So scientifically that doesn't make sense, because the progesterone should lighten and shorten because it's counteracting how much blood your body's building up, but it's not always going to do that. It's not always going to do what we expect it to do. And as I like to say, some women, or I guess men too, some people are allergic to Benadryl, which is the medicine we usually give for allergies, so not everyone follows what we expect the rules to be. The other end of the spectrum is going to be that some women are going to say, oh, you said I was going to have lighter, shorter cycles, but the cycles completely stopped in half, or they cut not just in half, but they cut completely off. So that's the other extreme. Some women will respond very, very strongly to the progesterone, so nothing gets built up, nothing comes out, and then they'll just have random spotting. They might have 2 or 3 days of spotting in January, nothing till April. They might have 1 day the first week of the month, 1 day the second or third week of the month, and then nothing again till the very end of the summer, maybe August. So it's completely unpredictable. They won't get cycles, but they may or may not get premenstrual symptoms, because PMS is due to ovulation. They're still ovulating, but then they'll just have random spotting. So whenever a little bit of blood has a chance to build up, a little bit of blood comes out, and that's why they have the random spotting. I do warn or caution everyone that someone's going to be in that group. Usually it's about 20% of women are in that group. We don't know who it's going to be. Some women are super uncomfortable not having a regular cycle. So if that's the case, they have to keep in mind that that is a possibility with the hormonal IUD. Now, the main reason why women who have the hormonal IUD remove it earlier than they anticipated removing it is, one, as I mentioned, until your body gets adjusted, it's a constant influence of trying to prevent blood from building up. So until your body gets adjusted, which on average is the first 6 months, you may or may not have random, wacky, no holds barred bleeding. You could have 3 straight weeks of bleeding, then nothing for 4 weeks, and then another 6 weeks of bleeding. Could be heavy like a cycle for 5 days, just brown smudgy, pink spotty for another 2 weeks, and then heavy again. It's completely unpredictable. You could have a cycle twice a month, cycle 3 times a month, 1 cycle in January, nothing again till April, and then 4 straight weeks of bleeding, no holds barred. Whatever abnormal bleeding you can think of is possible the first 6 months of the hormonal IUD, and that's considered normal. There's nothing to do. People used to, in the past, try to give birth control pills. Birth control pills will alleviate that or mitigate it, but once you stop the pills, they're just going to go right back to where they were. So you're just putting a Band-Aid. You might as well let it balance out. Some women are not prepared for that. Psychologically, they did not think they'd be in the group who would have that, so it's a deal breaker. The second reason why women who have the hormonal IUD removed earlier than they anticipated removing it is because progesterone, again, is also the source of premenstrual symptoms, and 15% of women with the hormonal IUD will have worse premenstrual symptoms. The most common ones that they come in for to have it removed is irritable, moody, emotional, angry. The second is acne, either face, chest, or back acne. The dermatologists always send them back to me because it's hormonal acne. For the PMS issues, they can just take a birth control pill to try to balance that out, but most women just want the IUD removed. So those are the biggest deals with the hormonal IUD, be it the 3, the 4, or the 5 year, it doesn't matter. Now, what I see a question here about finding the IUD. Now, what I tell everyone is to always come back 5 weeks after the IUD has been placed to confirm it's still really in place. And then I demonstrate to everyone and explain how to check for the IUD themselves. So what you should do is hike 1 foot up on the bathtub rim, toilet seat, doesn't matter. Whatever your dominant hand is, you place the index and the middle finger in the vagina and you direct them to the small of your back. You'll feel a ball, a ping pong, an olive, a table grape. It feels like a ball. That's the cervix. You really have to feel the cervix in order to feel the string. Every blue moon, someone can feel the string without actually having to feel the cervix. But realistically speaking, if you don't feel the cervix, you're not going to feel the string. So once you feel the ball of the cervix, you just rub your fingers along the ball of the cervix, and you'll feel, feels like suture material to me, of course, but you should feel the grittiness of the string. It feels like cat whiskers. If you're rubbing against the ball of the cervix and you feel the little friction of the cat whiskers, then that's the IUD string, you're fine. It should always feel soft with just the friction of the cat whisker string. If you feel anything hard or sharp, that's not normal. It could potentially be the butt of the IUD starting to stick out or protrude from the cervix. So the IUD is T-shaped and it should be in the top of the uterus. All of this T-shape should be in the body of the uterus, and the string, which is right here, the string should be sticking out of the cervix. So if this is the cervix, like that, you feel the cervix, you feel the friction of the cat whiskers or the string. So of course to me it's pretty easy, but it's practice makes perfect. So if you do that once, at least once a month, every month, you get used to what normal is. It's 1, 2, 3. If anything weird comes up, weird bleeding or pain, anything, you can always check to make sure it's not your IUD that's the source of it by just quickly checking the string. If you don't feel the string, then you need to see your gynecologist to see if they can see it. If they don't see it, they'll feel it. Sometimes the IUD twirls around and the string retracts, so it's pulled up into the upper part of the cervix. We can take a little hook or cider brush and pull the string down sometimes so that it's palpable. So I hope that's been helpful. Tomorrow I'll do kind of an overview and wrap up on the IUDs and some of the instructions, some of the information instructions that I give the patients who see me. I hope that's been helpful, and hope I feel like I'm talking a little bit weird. I've had toothache for 2 weeks now. I have a wisdom tooth that has a cavity, so tomorrow I'll present in the morning. I have to get this tooth pulled tomorrow, so Thursday. I don't know how I'm going to be on Thursday morning, but I'm going to be back here in the office after the tooth gets pulled, so we'll see. This wisdom tooth, I've just been putting Oragel on it, so I feel like I'm talking a little bit weird, looking a little bit weird. We'll see how weird it really is Thursday. So I hope that's helpful. I'll be back tomorrow with kind of an overview and wrap up on the IUD. Tomorrow's Wednesday, and then Thursday I promised a viewer that I would speak about preterm labor, preterm delivery. That's going to be a few sessions. I haven't really mapped it out. I don't write things out. I just kind of speak on the top of my head. I don't write anything out. So I'll try to do a little outline for that one because it's quite involved, and try to give a decent outline. I can't go into details, of course, or give detailed medical advice. But I hope everyone is enjoying their Tuesday, and have a great rest of the day. I'll be back tomorrow. Thank you.